Westmoreland Community Connections is a presentation of Citizens Fiber.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Jennifer Miele, Chief Communications Officer and Managing Director of Evangelization of the Diocese of Greensburg.
Welcome to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Miele. May is Mental Health Month. It's a wonderful awareness effort, and it was founded by Mental Health America. And I'm blessed today to be talking to the CEO of Mental Health America of Southwestern Pennsylvania. Her name is Laurie Barnett Levine. We've been good friends for years and worked together on several projects, and now I get to have her as a guest on my show. So Laurie, thanks so much for jumping on today. I appreciate it.
Thank you very much for having me on your show again. I always appreciate the opportunity to spread the word about mental health and our organization.
And you're doing such a great job. The whole premise of May is to create awareness surrounding mental health. So tell us a little bit about that founding by your parent organization and what kind of activities and promotions happen during May.
We are a private nonprofit and independent organization, but we're an affiliate of a national organization also called Mental Health America. And Mental Health America began in 1909. And it is one of the largest national organizations in the United States, focusing on eradicating stigma around mental health and focusing on wellness. And they decided to create this day. And one of the reasons I think that they use May is people think, oh, May is spring, everybody's spirits are lifting up. But what happens to people who have mental health issues is they see people around them and their spirits are lifting up. But the people that have mental health issues, their spirits are not lifting up. And people also think that most suicides occur during the holiday season, but actually statistics have shown historically that suicides increase in the spring. So May has been designated as Mental Health Month by Mental Health America, and many other organizations have joined in and acknowledged that May is Mental Health Month. And it's an opportunity to create many activities around mental health, mental wellness, focusing on how to keep yourself mentally well. And so there's community events. Right now, because of COVID, there aren't so many community events, but we've done some things at the mall, at some parks. What we're doing is we're holding a lot of virtual events. And our organization, with funding from Westmoreland County, is doing Mental Health Mondays. And we're having a variety of speakers virtually, all free, about Mental Health Mondays. And you can find them on the behavioral health website for the county, our Facebook page, or our own website, which is mhaswpa.org.
That's wonderful. I know I'm on your mailing list, and I received some information from you about even a movie that you guys, you're trying different ways to connect with different people. Tell us a little bit about that movie premiere and how that went.
That was fantastic. We showed a movie called My Ascension. That movie actually was filmed by a man who's a filmmaker who has done another award-winning film about suicide, about a man named Kevin Hines who jumped off the Golden Gate Bridge as a suicide attempt and actually lived. And he devoted his life to being an advocate to create awareness for suicide. And that film was called Suicide, the Ripple Effect. But this is My Ascension, and it's about a young, beautiful, successful teenage girl who attempted suicide and had brain damage and lost her ability to walk. And as a result of that, though, she was inspired when she heard Kevin Hines speak, and she has made it her mission to talk about what happened to her. Why did this happen? Someone on the outside who looked so beautiful, so successful. She was a cheerleader. How did that happen that on the inside she was so sad and felt that her life wasn't worth living? And the film gives some insights for parents, for people who've lost loved ones, even for other students, to understand what happened. And sometimes it creates self-awareness, that this is happening within themselves, and it gives them the opportunity to talk about it. We had a panel And the panel had local experts on it, as well as the young woman in the film and the filmmaker. And you can see that panel on a Facebook page called My Ascension. And you can also see other panels from other groups. So there's professors from Yale, other people that are discussing this. We had over 200 people sign up to see this film in the Southwestern Pennsylvania area. And some of the feedback we got is that for some parents who lost children to suicide, that it helped them to understand at least what might be going through their loved one's mind and brought them some type of peace. For other families that have young people, some of them that they knew were at risk have had suicidal thoughts. They watched the film together, and it created an opportunity for them to have a discussion about this. And if people are interested on Eventbrite, they show when the film is being shown in other parts of the country, and you can join on and watch it in other parts of the country. Our showing was free. It was we paid for it, but we showed it for free. I think in most parts it is also for free. One of the things that I wanted to bring up is that in June, the CDC, the Center for Disease Control, actually last June, they did a study of adolescents, of young adults, I should say, 18 to 24, which is called the transition age period, which is a time when youth are transitioning from being children into adulthood. And so many people, all of us, really, we don't have the equipment to be adults when we're 18, although sometimes there's that expectation that we are. And the brains of people who are 18 to 24 still are not fully formed. And the part of the brain that controls impulsive behavior is not fully formed. And so that's a very high risk age group for suicide and suicide awareness. And the CDC did a study, and in that study, 25% of the thousands of youth that responded reported that they had had suicidal ideation in the last 30 days. And that's a really big increase. And we think that, part of that has to do with COVID and the social isolation. We also know that the suicides are not increasing, which is a wonderful thing, but the numbers to the crisis lines are increasing. So we think what's happening is that people are reaching out for help, and maybe because of COVID, there's more availability of help, and people are reaching out to try to access help. Sometimes there are waits, though, to get services for people who decide they need services. So that's a very critical need in the service system. And advocates like myself are always advocating for more funding from the legislature. And that's part of the reason, because of the increasing numbers of people that are identifying this. People are talking more about mental health. And, like you give me this opportunity to talk on this radio show about this, then that normalizes the conversation around mental health. And, one of the things that we hear a lot is the tagline, "It's okay to not be okay." Mm-hmm. And that not everybody has to be picture perfect. And you should talk about it, because that will help. That the research has shown that by talking about it, that helps your mental health.
It's true. And as traumatic as COVID-19 has been for the entire world, just a worldwide pandemic, do you think it did bring mental health to the forefront? Do you think people are now more comfortable talking about caring for the whole self?
I do. I've been interviewed a lot. I've been asked to do workshops a lot. Never before so much as now in this last year, talking about mental health in the workplace, bringing up the conversation even about suicide, because people think, oh, that's something that happens to other people. But it really, what we've seen from our experience is that the people that it happens to are people, just like you and me, families just like yours and mine. It's not, quote, those other people. And so it is very good to be able to talk about it. I think that, Hollywood, movie stars, famous people, talking about mental health has also increased the conversation about mental health and normalized it more. Unfortunately, there have been some very prominent suicides, like Robin Williams, and he's another person that you really would not suspect, someone who looks so happy on the outside, although he did have a very serious disease, but, was tragically unhappy on the inside. And so designers, movie stars, so that it's really important to have this conversation. And I think COVID, we knew that there were risks, factors associated with COVID, so that we really did bring mental health into the conversation. You saw it on the news, you saw segments devoted to mental health on talk shows, in newspapers, radio shows like this, everywhere. And so I think I like to think that that's part of the reason that the suicide numbers are down. But the other thing is that during the last recession, we saw a similar pattern where the number of suicides were down, but a year or so later, there was a sharp increase. And we don't know for sure, but we think that what happens is while the crisis is happening, and even now we consider this still the crisis phase, people are still in the crisis responding mode, or the heroes are busy being heroes. And then after that happens, and things return to normal, whatever that is, then people start taking an assessment of what's happened, or the effects of the loneliness and the isolation begin to mount. We're really concerned about our children and school. They have, in a sense, lost the year of school for many students. They've experienced social isolation at a time when interacting with their peers is so important to their own development. And so there is a lot of concern, and people are watching about what's going to happen a year from now, when the real impact of all of this begins to hit. There have been so many losses. People lost loved ones. They lost the opportunity to have special events, things like weddings, even for some people, things like funerals. They weren't able to really mourn the loss of their loved one. Holidays were changed. Large family gathering. Suddenly there were like 4 people around the table. I've seen pictures of people celebrating with their computer open on their table, and that's how they're celebrating a holiday. They're all alone. The elderly, people who are at high risk, they're sitting with a laptop or an iPad on their table, and that's how they were celebrating their holiday. So it's had a lot of impact on a lot of people, and people are still suffering now. There's people that are still ill, very ill from COVID, and we are still in the crisis mode.
No question. And I think what your virtual events are doing are creating a pathway to some coping skills, creating a pathway to help, so that people recognize this mental health issue that they're having and can find help to deal with it. And I think that's so important. I have so much respect for all of the information that you're putting out. I remember watching the preview to that movie, My Ascension. And I remember just thinking as a parent, listening to the parent talk about saying, I had no idea. I talked to my child every day. My child was involved. I was there at her games. I was involved in all of these things, because they were never trained to understand what any kind of symptomatic progression would be. And, their daughter probably not having a feeling that she could express what she's feeling. And so this convergence of COVID and this focus on mental health, hopefully people will ask for help. And I think that's what you're encouraging people to do.
And a lot of times for the students, it's the very successful student. It's a student that's really driven to succeed. Like, what if I get a B or a C on this test? Well, then if I get a B or C on this test, then my grade point average is going to suffer. Then I'm not going to get into a college or university. Then I'm not going to have a good career. Then my life isn't. And it's like catastrophic thinking. Sometimes for students who are used to being very successful, and they don't verbalize this because they're busy trying to be perfect. And so sometimes it's a student that you don't think, it's not the student who's isolating themselves and not talking to anyone and failing miserably, although it could be that student, but it's often the successful student. And that this film highlighted a successful student.
Fascinating conversation today with Laurie Barnett Levine. She's the CEO of Mental Health America of Southwestern Pennsylvania. May is Mental Health Month, and we will be talking more about that right after this break.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of Citizens Fiber.
Welcome back to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Miele. May is Mental Health Month. And to discuss that topic, I am joined today by the CEO of Mental Health America of Southwestern Pennsylvania. Her name is Laurie Barnett Levine. We've been colleagues for many years, worked on many projects together. And today we're talking about fundraising, and the ability to keep the outreach going directly depends on how much support the community can provide for Mental Health America of Southwestern Pennsylvania. Knowing that outreach, even virtually, costs money, they did decide to do an online fundraiser this year, an event that I've attended for years and years, pushed online. And tell us about the format of that event. How did that work, Laurie?
Well, it's very interesting. And you for years have been kind enough to be the MC for that event. And it's always been a lot of fun. It's very gratifying, honoring. We call it innovations because we're honoring people who are visionaries in the community. And we do that because we want to honor them. We want to honor their good work. But we also want the community to know that there are these important things that are happening within their community and that there's very special people in their community, and to raise the conversation about mental health. So last year, we usually have this event around May because May is Mental Health Month. And it usually has been an in-person event at what used to be the Ramada, which isn't even there anymore. And
so many changes.
Be sure, and losses. We used to enjoy getting together, and we would have this fun event. We would have raffles, and, we would honor people, and there'd be music, and sometimes there'd be artists there. And what happened is we thought we were going to have it in June. And so we postponed it till June. And when June came, we realized we couldn't have it in June either. So we still honored the people that we expected to honor at our annual meeting, which was in the fall. But it was a virtual event. So it's very different planning a virtual event than an in-person event. And my staff never knew they were going to be like Hollywood producers when they applied for this job and got like their master's degrees in human services. And so we've had to learn all about Zoom and Zoom rooms and, how to do that. And I've had to learn how to make presentations online and have meetings, and conversations online. And so we did this in the fall, and we were able to honor those people, but we went back to having it traditionally again around May. And so we are holding it, unfortunately, after this. The show is being aired after the event, but the event was April 29th. And at that time, we honored some individuals who have really been transformative in Southwestern Pennsylvania in terms of behavioral health. A woman named Pat Valentine, who was the retired executive director of the actual integrated program and services for Allegheny County Department of Human Services, where she worked for decades and really helped to transform the system into what it is now in terms of being more recovery focused, helping to care for people in the community, doing care for people who are in the jails and prisons. And then we also honored a woman named Susan Cole, who is the president and CEO of an organization called Presley Ridge, which is not only local, but throughout Pennsylvania, but in several states. And they provide care to children and families. And another individual that some of the listeners may know is Phil Koch. Phil Koch is the former executive director of the Westmoreland Community Foundation. And now he's the vice president of policy and community impact for the Pittsburgh Foundation. And you think, well, why are we honoring him? We are honoring him in education. And the reason that we chose to honor him in education, because while Phil was the executive director, he, instead of just, quote, giving away money, he created educational programs for the nonprofit sector in Westmoreland County. And he created a group called WESCO, which is the Westmoreland County for the nonprofits. He brought in speakers that talked to the leaders and the executives of the nonprofits to help to strengthen the nonprofits and to sustain them. So it's not always about money, it's about expertise and creating the capacity within the organizations. Another group that we honored is called Avidum, which is it is in a rough translation from Latin, which means I've got your back. And it is part of the Greater Latrobe School District. It's a program that they have, very similar to what the young lady in the film, was advocating for, programs that help other students know that there are people that are there for them, that it's okay to talk to people when you're not okay, trying to decrease the stigma around mental health and have discussions about depression, suicide, and other teen issues to open that conversation. And the final person that we honored is Dr. Mark Fuller, who is the medical director for addiction diseases, I guess, at the Allegheny Health Network. And he has really been very supportive of Mental Health America, of reaching out into the community. He has provided workshops for us about addiction and the addictive disease process. He's worked very closely with people that have mental health issues and substance use issues. So those were the people that we chose to honor at Innovations. And we are going to be recording the event, and it will be able to be seen, I think, on YouTube, but there'll be a link to it on our website in the future so that people can tune in and see it if they're interested in seeing it. The other thing I wanted to say is that, we have found some silver linings in COVID. There's ability to attend more meetings and conferences because you can do it virtually, and it saves the system money. The other thing is, with the governor's emergency declaration, the federal government has authorized the use of telepsychiatry and telehealth, so that, there are parts of Westmoreland County where it's very hard to get from here to there, especially if you don't have a car. And so people found that it was easier to maintain their medical appointments, both for their mental health and physical health. And so we found a much greater amount of people adhering to their appointment times. And it made people feel like they could access services more easily. And so we think that really helped. And you talked about funding, and the mental health system has always been underfunded. And like 12 years ago, there was a 10% cut that was never restored. And so we continue, because we're all like social workers and do-gooders, and we always want to do the right thing. So we always try to do more with less, but we're reaching the breaking point now. And you're seeing the disintegration of the human service system, not through anyone's fault or because of lack of professionalism or trying or expertise, just because you can't continue to do more with less. And it's becoming more difficult to attract people to the profession. Although people want to do good, they want to help others, they can make more working in a convenience store sometimes than they can working in a mental health program. So one of the things that I do in my capacity is talk about how important these safety net programs are to the community, and how they're really an investment in the community and an investment in the people that we care about. And it is the right thing to do. It is the right thing to help care for people who, for whatever reason, don't have the ability to care for themselves. And so we need to continue to fund these very valuable programs. We know that the jails, there's more people in jail than in mental hospitals and that have mental health issues. And, we need to address this issue and treat people in the community and divert them from using more expensive, more restrictive levels of care. So that's some of what I talk about, and that's why I'm mentioning it here, and the importance for the community to recognize that this is an investment in their community.
Absolutely. And you talked about how telehealth, the virtual medicine, has really just exploded during COVID-19, and you saw the ability for therapists, psychiatrists to be reimbursed from health insurance companies while doing telehealth. Is that something that you would like to see continue?
Very much so. Prior to COVID, that was something that the providers were advocating for because they thought it would make it easier for people to access services. And COVID really sped that up. And so we want that to be able to continue. Not that that should be the only service that people receive, but that it will continue to help people to access care.
And that's going to be, I'm sure, an important part of your advocacy efforts moving forward, because we certainly don't want to see that go backward, right? I mean, if the usage is up and people are comfortable with it, then you want to make sure that that's an option. That's
right. And as I'm talking, one of the things I wanted to talk about is that your mental health and your physical health are intertwined. People don't realize, everybody has mental health. Sometimes your mental health is good and sometimes you're stressed out and it's not so good. And the impact of your mental health, it really has an impact on your physical health. There is a chemical connection in your body between your mental health and your physical health and vice versa. And so that people don't really understand that. They think that like, if you just, if you were a better person, if you didn't have this character flaw, you wouldn't have a mental health issue. But having a mental illness is not a character flaw. It's a true disease, just like any other disease. And sometimes when you have periods of prolonged stress, that can bring on a mental health problem. It can create depression. And if left untreated, then it gets worse and then it becomes harder to treat. So that we really want to emphasize the importance of people being able to recognize that they might have a mental health issue. And there's free screens that you can take on our website. They're anonymous, MHASWPA.org. And they're evidence-based screens that you can go on and take these, and they can tell you yourself if you're experiencing depression, if you're experiencing anxiety, and then you can know that, oh, gee, this is really happening to me and I need to get help. What we've seen is that a lot of young people are taking these screens. And I think that's good because sometimes people have a mental health problem, but they don't realize they have it. They don't realize they're depressed. They kind of know something is wrong, but they really don't understand what that is. So, if you had diabetes, you wouldn't say, just get over it. You would treat it, and you wouldn't wait till it went on and on and on. And so what we do now is we talk about, if you have a mental illness, it's a chronic condition, just like any other chronic condition, like arthritis, like diabetes, like, a thyroid problem, so that it's not, there should not be stigma associated with having a true illness. And having a mental illness is a true illness, just like any other illness, and it can be treated. And sometimes it's temporary, and it can go away with proper treatment and recognition. And that's one of the messages that I wanted to share today.
Laurie Barnett Levine is the CEO of Mental Health America of Southwestern PA. So there's your acronym there for the website in case you're interested in looking at any of their virtual events, accessing what help is available, and even taking that mental health evaluation, that mental health quiz that you were talking about, that's so important to assess your own well-being. And that's MHASWPA.org. So that acronym, Mental Health America, southwesternpa.org. We're so thankful that you joined us today for May and Mental Health Month. We really appreciate it, Laurie.
Thank you very much. And I wanted to add, I'm sorry that people missed our event, but if they would still like to support our organization, there is a donate now button on the website, and we sincerely welcome all donations. And thank you so much for having me on your show. I really appreciate it.
You're listening to WHJB. I'm your host, Jennifer Miele, for Westmoreland Community Connections.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.
Westmoreland Community Connections is a presentation of Citizens Fiber.